Thank you again for taking the time for this interview. It will help the King's Academy community and those participants from beyond our school throughout the country and beyond to learn about and grow from this moment. Jordan's response to the COVID-19 pandemic has been a model of what it means to take proactive measures against this virus. It has been impressive to watch. The nation took bold steps once there was any evidence that cases were emerging within the country, and not only flattened the curve, Jordan turned the curve into a line. Growth was never exponential. When looking back at the numbers, since the very first case, new cases per day have been only in the single digits or teens, with the exception of just a handful of days. These are extraordinary figures, and people from around the world have looked to Jordan as a model for how to proactively and successfully reduce the risks of this virus. Certainly, we as a school are grateful. People in the country are proud of the work of the national effort. So thank you first. Shukran katir.
You're welcome, sir. Thank you.
Thank you. In our interview today, I'd be glad for our students and participants to learn more about leadership in a time of crisis like this. Was there a single piece of evidence or a single piece of data or a single factor that led you to act so decisively, so quickly?
Yes, it was the 22nd of January, actually, when I read some reports coming from China. Quarantining 9 million people or even more, 20 million people in Wuhan, and seeing the whole policemen wearing those coveralls and everybody worried. So I thought, well, it's coming and a big danger is coming. It was the 22nd of January. So on the 24th of January, I had the National Committee for Infection Control gathered in my office here, and we were discussing. And on the 25th of January, we started putting thermal sensors at the airport, and we banned traveling to China that time, so early, to China and South Korea at that time, I remember. Trying not to import the disease at the beginning, so to allow ourselves to build capacity and to think and rethink and plan. So this gave us some time. It was the turning point on the 22nd of January, when I read some reports and I saw the documentaries at that time. It was, literally horrifying, and the Chinese response was out of proportion of what the whole world was thinking. It's something, okay, it's a flu epidemic, not dangerous. I thought at that time it's highly dangerous and it is highly contagious. Putting 20 million people in quarantine at that time, that was my turning point.
So when the world was responding rather casually, but you
Yes.
saw the severity of their response, you said they must be doing that for a particular reason, and then seeking to understand what that, or estimate what that reason might have been, that led to your immediate preparations here.
Yes.
Yes,
that was my...
Were there turning points later on, or rather, was when Jordan did act, we act around March 12th or 13th or 14th, we acted very decisively. And was that as a result or as a response to what you had seen elsewhere?
To tell you the truth, we acted before that, but decisively, the whole country was put into to act. So during February, I knew nowadays 50% of your battle or of your work should depend on the media. So I started with my team a huge media campaign to make people aware of this disease. That was something we worked hard, because we realized that without the cooperation of the people around us in Jordan, we will never succeed. So we started slowly a media campaign. We started to build our capacity. I didn't have enough isolation spaces in the hospitals. At that time, we didn't have enough PPEs. personal protective equipment. I checked what do we have. So we had to start making them because we couldn't import them. I found that the world is having no masks, no coveralls. So we started gathering people, factories. What can you do? How can you make masks? So we worked with the Minister of Trade and Industry to give them license to start working. And they started with 2,000 masks a day. Now we can produce 1 million masks a day. We had at that time only 2,000 coveralls for biological warfare. And now we produce 2,000 coveralls a day. So the world shortage, we started to ask for what kind of tests do we have? So we sat with the people at the labs and we discussed how we can improve our capabilities. At that time, we had only 1,500 PCR tests. Now we have 150,000 PCR tests in Jordan, and we are even improving. We could do 250 tests a day. So I have to gather everyone to improve our capabilities and capacity. So now we can do 3,000 tests a day. All that improving capacity was hand by hand by trying to prevent the disease from coming in, and in case it comes in, to keep the numbers low. To keep our curve flat, or to flatten the curve as much as we can, to allow our medical team to get experience, to accustomed to deal with the disease, and to prevent our trained people in biological warfare and in those things to train others. When the first case arrived in Jordan, we had 492 lectures about dealing with COVID-19 for my staff at the Ministry of Health. They were well prepared before the first case arrived to Jordan. So building capacity, knowing what you have, improve your capabilities, try to prevent the disease at the borders, ban travel to hot areas.
What is the role of data in your decision making, or in the role of in your communications?
Well, it needs a human organizational issue to have proper data. So luckily at the Ministry of Health, we had good data resources to know what I have, what kind of training they have. I mean, we work all 24/7 in harmony with the team. The human resources data, equipment data, international data are very important to me. So from day one, I contacted WHO, and I have to receive their data daily. Actually, the representative of the World Health Organization, WHO, is part of my team at the National Infection Control. When we gather, she comes and she sits with us and we discuss working together, knowing this emphasizes that this is an international calamity and this is an international issue, and the international data concerns us because we are one village nowadays. So it's very important to have proper data documented, and no one is better than the WHO to get the data, proper data, and analyzing them to study the patterns this disease have in different countries, and how we can get the good things some countries have done and what wrong others have made. So to get lessons, because there was no textbook or protocols or guidelines for this disease. So we have to build our own guidelines. Also, I have to look at my resources, gather national resources. Actually, at that time, the government and actually His Majesty the King, from the Royal Court, they asked for the whole national capability early March. What do we have? Respirators, ICU beds, hospital beds. Then we started at a higher level, gathering together and planning for the whole issue at that time.
Thank you. One last question, knowing your time is precious. What counsel would you give to young leaders during looking to participate and engage during this time or in the future?
Well, believe in yourself. Believe in your teamwork. I mean, believe, work in harmony. Always have plans and backup plans. Always. Never give up. You know, never give up. And there will always, when you have a plan or doing something, there are some things aside that might distract you. Concentrate on your target. Concentrate in implementing your plan properly. Have backup plan in case you fail. Failure is not something that should make you collapse. It should give you strength. You have 86,000 minutes a day. If you have 20 minutes, I mean, of distraction, they are not important. You have success in the other minutes of your day. So don't think a lot. Concentrate on your plan. Be proactive and have your plan. Stick to them. That and teamwork. Always teamwork, and have good counselor around you to tell you what's going on. It always helps, and this is the key to success, I believe.
Your Excellency, the Minister of Health, Saad Jaber, thank you again for your efforts and for the efforts of the government in this challenging time. We're so grateful here at our school and here in the country. And thank you as well for spending some time with us, sharing your thinking. For our students and participants, this is a really valuable lesson in leadership. Thank you.
Thank you, sir. Have a nice day.
You too.